Ma'am SUPEña. I am your student nurse for the day. I am ROSALY SUPEña. So, how would you like to call you? Is it Noreen or SUPEña or so?
Just call me Noreen.
Oh, okay. So, Ma'am Noreen, I am taking your vital signs for today. Is it okay with you?
Yes, it's alright.
So, can you rate your pain right now? 0 being no pain and 10 being the worst pain you ever had. So, what is your rating, ma'am?
0.
So, my patient says that she's having no pain right now. So, next, I will be taking your temperature. Is it okay with you?
Yes, it's alright.
And we will be using your auxiliary for the rate. So, while waiting for your temperature, ma'am, I will get your pulse rate. Is it okay with you to touch your hands?
Yes, it's alright.
So, to get pulse rate, you will be palpating the patient's radial artery. And it is the most common location where you can palpate the pulse rate. So, first, find the pulse of the patient and then put your 3 fingers on the radial artery. So remember to never use your thumb because it has its own pulse. Use your 3 fingers instead. The index, the middle, and the ring finger. Put it in the radial artery. Remember that do not put too much pressure to the artery because it may alter the pulse rate of the patient. So first, let's find his or her pulse. And then, so now I find it. When the pulse is regular, you will count it in 30 seconds and multiply it by 2. While when the pulse is irregular, you need to count it in full minute. Also, we will be grading it 0 to 3. 0 being no pulse, 1 plus being a weak pulse, 2 plus being normal, and 3 plus as bounding. So my patient's pulse rate is 82 and I will be grading her pulse as 2 plus and it is normal. So the normal pulse for adult is 60 to 100 beats per minute. So now I will be getting the patient's respiration. We need to look for the chest rise and fall because 1 rise and 1 fall equals 1 respiration. We need to count it in 30 seconds and multiply it by 2 if the breathing rate is normal, and we need to document it or count the number of respiration in 1 full minute if the breathing rate is irregular. So, you can put your hand in the back of the patient and feel the rise and fall of the patient's chest. So, her respiration is 16 beats per minute. So, it means that it is normal because normal respiration will be ranges between 12 to 20 beats per minute. So now, I will be taking the blood pressure of my patient, and to perform that, we will need the equipment. So we will be using a stethoscope and a sphygmomanometer. So let's start. So first, make sure that her hand is at her heart level. So after making sure that her hand is at her heart level, next thing to do is find her brachial artery. Alam ko yun. So next, let's now put on the cup. So put the cup 2 inches over the line of her hand. So put the cup 2 inches over the line of her hand. So make sure that the cup is not tight and also not loose.
So the blood pressure of my patient is 110/70, and that is normal. So the normal blood pressure is 120/80 millimeters of mercury. So after that, let's remove the cup and remember to deflate it completely.
So now we will be taking your oxygen saturation. So let me borrow your finger and I will insert oximeter to identify your oxygen saturation. So this is a digital oximeter. We will be using this to determine the oxygen saturation of our patient by inserting his or her finger inside the device.
So the normal oxygen saturation is between 95 to 100%. So the patient oxygen saturation is 98% and it is normal. And also we can see her pulse rate in this device.
So good day, ma'am. Um, you are Noreen Joy Supenya, am I right?
Yes.
So what is your birthday, ma'am?
February 21, 2002.
So, okay. So I am your student nurse for today. I am ROSALY and SUPEña, and I will be the one in charge in changing your beddings. Is it okay with you?
Yes.
So, let's start now. So I will be guiding you, ma'am, in some position. I hope your cooperation. So let's start.
To make an occupied bed, first gather the appropriate supplies with the linen stack in order of use from top to bottom. Place the clean linen on a clean surface, such as a bedside table. Next, put on the gloves. Then put the pillow, if to be used, on a chair. Remove the soiled linens. Avoid shaking the linens or letting them touch your uniform. Snugly roll all the linen inside the bottom sheet and place directly into the laundry bag or hamper. If the mattress is soiled, clean it thoroughly. And then remove your gloves and perform hand hygiene. Now, apply all the bottom linens on one side of the bed. For a fitted bottom sheet, tuck its head and foot corners under the mattress. If needed, apply a draw sheet. Lay it center fold lengthwise in the middle of the bed. Smooth the draw sheet over the mattress and tuck the excess under it. Now, move to the other side of the bed and spread the linen smoothly over the mattress edge. Next, smooth the folded draw sheet over the bottom sheet and tuck it over the mattress. If needed, apply a waterproof pad over the draw sheet. Then place a blanket on the bed with its top edge parallel to and about 6 to 8 inches below the top sheet. If desired, place a bedspread similarly over the blanket. Now make a cuff. At one side of the foot of the bed, lift the mattress corner with one hand. And with the other hand, tack all the top linens together under the mattress, then made a modified metered corner at the top sheet blanket. Now, move to the other side and finish making the bed. Now, make a horizontal tautlet by pan-folding the top sheet 2 to 4 inches across the bed, about 6 inches from foot of the mattress. Lastly, invert the clean pillowcase over one hand, and with that hand, grasp the middle of one end of the pillow, and with the other hand, fold the case down over the pillow.
So good day, ma'am. You are Nuring Joy SUPEñA, am I right?
Yes.
So what is your birthday, ma'am?
February 21, 2002.
Okay. So I am your student there for today. I am ROSALY and SUPEñA, and I will be the one in charge in changing your beddings. Is it okay with you?
Yes.
So I will be guiding you, ma'am, in some position. I hope your cooperation. So let's start.
To make an occupied bed, first consider the patient's condition and gather appropriate supply with the linen stock from top to bottom. Place the clean linens on a clean surface, such as a bedside table. Now, perform hand hygiene and wear a pair of gloves. Adjust the bed height into a comfortable position. Remove the blanket or bedspread, folding it in quarters with the outer surface on inside. If it will be reused, place it on the bottom of the bed. If it is soiled, put directly into the hamper. And after that, place a bath blanket over the top sheet and have the patient hold it in place as you pull the top sheet down under it. Fold the top sheet onto a bundle with the soiled side in and do not shake them into the air. Hold them away from your uniform and discard it in a hamper. Now, help the patient roll away from you onto the side and adjust her pillow. After loosening the bottom linen, pan-fold the bottom sheet, draw sheet, and any pad towards the patient and tuck it in her buttocks, back, and shoulders. Clean and dry the mattress if it is wet or soiled on the side. Next is to place a clean mattress pad, fold it lengthwise on the bed with a center in the middle. Pan-fold its top layer over the mattress. Then place a clean bottom sheet, fold it in half lengthwise on the bed. For the fitted sheet, tuck its head and foot corners under the mattress. Then tuck the excess under the bed. If needed, place a draw sheet on the bed. Lay it centerfold lengthwise along the middle of the bed, positioning it under the buttocks and torso area. Then panfold the top layer toward the patient. Now, smoothen off the bottom layer and tuck the excess under the mattress. If a waterproof pad is needed, place it similarly. Now, on the other side of the bed, loosen the soiled bottom linens and fold them onto a bundle with the soiled side in. Do not shake them in the air and hold them away from your uniform. Next, discard it in a hamper. If needed, clean and dry this side of the mattress. Now, remove your gloves and perform hand hygiene. Now, fold the clean linen smoothly over the mattress from the head to the foot of the bed. For the pitted sheet, tuck its head and foot corners under the mattress. Then tuck the excess under the bed. Next, smoothen off the panfold draw sheet and pull it tightly towards you. Tuck it under the mattress. If waterproof pads are needed, smooth them under the patient. Roll the patient to a supine position and adjust the pillow for her. Place the top sheet over the patient with the center fold lengthwise on the middle of the bed. Then open the sheet from the head to the foot and unfold it over the patient. With the patient holding the top sheet, remove the bath blanket and discard it in the hamper. Place the blanket on the bed and unfold it. At the foot of the bed, lift the mattress corner with one hand, while the other hand, tuck all the top linens together under the mattress, and repeat the step to the other side of the bed. Now, take the pillow from the patient's head and remove the soiled pillowcase and discard it in the hamper. Then invert the clean pillowcase over one hand. With that hand, grasp the middle of one end of the pillow. With the other hand, fold the case down over the pillow.